Hi, everyone. Thank you so much for being here today. We're just going to give it 1 minute for folks to log in. I see the attendee number growing. Thank you all for being here for our final COVID briefing of the year. As you're joining us, if you could introduce yourself in the chat, you can toggle to chat with all participants and attendees, or all panelists and attendees, excuse me, and tell us who you are and where you're joining us from. Love to know who's in the virtual room. All participants will have your cameras off and be muted for the duration of the webinar, but you can share with us through the chat who you are and where you're joining us from. I'll give it just another minute for folks to join. Hi, everyone. I think we'll go ahead and get started. I see attendees still trickling in, but I want to make sure we have as much time as possible for our speakers. So we'll go ahead and get started. If you're just joining us, all participants are muted and we'll have your cameras off for the duration of the webinar. But we'd love if you'd introduce yourself in the chat. You can toggle so that you chat to all panelists and attendees and let us know who you are and where you're joining from. Over the course of the hour, you're also welcome to use the chat to share resources, reflections, etc. We also invite you to ask questions of our panelists, and if you'll do that through the Q&A portion, that will be easiest to keep the chat separate from the Q&A for us on the back end. If you need any technical support, you can email my colleague Jacqueline. Her email is there on the screen, or you can chat Southern California Grantmakers directly. And just a quick note that this webinar is being recorded. So without further ado, I want to welcome you all. Thank you for joining us today. My name is Katie Pellissier. I'm the Senior Manager of Programs and Conferences at Southern California Grantmakers. Now and for the duration of this crisis, SCG's mission in response to COVID-19 has been to mobilize philanthropy by responding rapidly, effectively, and equitably to the pandemic, and fostering inclusive collaboration, learning, and bold actions. For that reason, we've been coordinating funders briefings since March of this year on a variety of topics related to the pandemic. I want to thank all of you SCG and Philanthropy California members for joining us for those and for the enormous work that you've done for our communities. I also want to thank our partners and co-hosts today, Northern California Grantmakers and Catalyst of San Diego and Imperial Counties, whose members are also joining us for this webinar. Unfortunately, as we all know, case rates right now are worse than ever, especially in California. We cannot avoid that fact, and I'm sure it will come up in today's conversation. But as we close out 2020, we wanted to spend an hour with you all starting to think about what the new year will look like and how philanthropy can best engage as we enter a new phase of the pandemic response. Politico recently called 2021 the year of transition. The vaccine will start rolling out widely, which is a source for great hope, but we'll continue to see and feel economic repercussions even more intensely than we already have, especially in state and local government and in our nonprofit sector. And we know that these repercussions will disproportionately harm communities of color. So for that reason, today we've assembled a panel of 3 speakers who can each share really complementary areas of expertise and perspectives on those different points, and help us understand what we might expect in the coming year. Joining us today is Chris Haney, Executive Director of the California Budget and Policy Center, Dr. Christina Galley, Director of Los Angeles County Department of Health Services, and Deepa Iyer, Director of Movement Building at Building Movement Project and Director of Solidarity Is. Thank you all so much for being here for one final COVID webinar of the year. We really appreciate you taking the time. I'd like to start with Dr. Galley. I know I'm speaking for probably everyone on this webinar when I say I'm so filled with hope at the sight of all the vaccine distribution happening across the country this week. Can you share with us a little bit about what's happening right now and then give us some broad brushstrokes about what to expect in the coming year?
Sure. Good afternoon, everybody. Thanks for joining. I hope everyone's doing well. I'll touch on vaccine and then give everyone just also a little bit of context of what we're experiencing and where Department of Health Services has been active throughout this pandemic. First on the vaccine, which is really top of mind for all of us. We were so thrilled to see the first injections being given yesterday. and optimistic about the hope that that holds moving forward. Department of Health Services is very active in the vaccine distribution process here in Los Angeles County, as are a number of other institutions. And so our role right now in the vaccine is balancing the very expedient delivery and redistribution of those pre-positioning points of vaccine, which largely arrived yesterday and today, to all of the different acute care hospitals across Los Angeles County, and other counties are managing it in much the same way. And then within that allotment, there's a supply of vaccine for the level 1A tier, which is healthcare workers. And so all of the vaccine that was provided will go to those healthcare workers, including we have an allotment for our own staff within the Department of Health Services. So we have 30,000 staff within DHS. And our initial vaccine allotment will cover about 6,000. So obviously it will give us a good start on trying to get vaccinated, the amazing healthcare workers that have been on the front line throughout this pandemic, but will not get us all the way there, and won't get us all the way through that, even that initial highest risk tier. So because of that, we've had to sub-tier our staff with a focus on those who have the highest risk of exposure based on their work location and their clinical activities or non-clinical activities. That takes into account whether or not they're interacting with COVID positive patients around aerosol generating procedures, or whether they're exposed to infectious waste materials, such as in the laboratory or among our environmental services staff. We also take into account whether or not people have had COVID within the last 90 days, whether or not they have age greater than 60 or underlying medical conditions. And then we plan on using all of those 6,000 vaccines over the next several days. And then we're eagerly awaiting when the next distribution will be of either the Pfizer or the Moderna vaccine. We know, though, that as much as we're excited about this vaccine being here, and it does offer a really critical element of protection to our staff, it is not going to get us out of the woods of the current surge that we are in, and it will not get us out of the woods anytime soon. So people just need to, accept that that's the case. I do think it is important, obviously, and the sooner you start, the sooner you can start to change those curves. But the curves that we're looking at when we look at the projections of bed demand are frightening. We've already had a very quick doubling time on the number of patients in the hospital, and that's projected to even further accelerate. Our projections that the effective transmission rate, are going to continue to rise and have continued to rise. Sadly, the public pleas to remain indoors, stay at home, the reopenings have not been successful to date on reducing that effective transmission rate. The hospitals are busy. We operate the 4 public hospitals in Los Angeles County, and there are 70 911 receiving hospitals across the county, and everyone is full. They have all started to flex staffing ratios, curb non-essential surgeries and procedures, bring in any additional staff that they are able to do through a variety of channels, move care into non-traditional or typically unlicensed care settings, and those steps will have to continue. Hospitalizations in Los Angeles County today exceeded 4,400. That's double the peak that we were at in July. And again, the numbers are projected to continue to double. And I am very sad that we have not hit the peak. And we are going to have, very unfortunately, a lot of loss of life. The death counts will go up greatly over the next couple of weeks, and I think people need to be prepared for that. And the stress and strain on the hospital system will result in deaths that otherwise could have been avoidable, both COVID and non-COVID deaths. What we want more than anything is for people to stay home. We do want people to try as much as possible to heed that public health order, those public health orders that are in place across the entire state. And I think it's really important for people to understand the context that, I have a lot of just casual conversations with people that they feel that they are doing everything that they always did, and they don't understand why it's worse. It's worse because just the broader base of infectivity right now in the general population. So when someone participated in an activity in September and they said, well, it was safe, I got together for dinner, or I went to a restaurant, or I was at the playground with my kids, or whatever it is. Well, the estimated number of individuals that were infectious, not isolated, that were actively infecting others in September was 1 in 880. And this week we're projecting 1 in 80. That's an 11-fold increase. So when you have an 11-fold increase in the rate of infectivity among the general population that's not properly isolated, an activity that was safe in September is just not safe. And I think that it doesn't then mean that people need to understand that if they keep doing the same thing, then they are part of the problem. People have to actually start doing more to get us to curve this trend down. DHS, I'll just touch on briefly so you get a sense of some of the other activities we're involved in, but I won't go into too much detail. Obviously, besides managing our own hospitals and clinics, we also operate the Emergency Medical Services Agency within Los Angeles County. So we're in charge of the MOAC, the Medical Health Officer Area Coordination Program, to coordinate among public and private hospitals. And we're working on a variety of transfer protocols right now for that. We operate community testing within Los Angeles County, and I've had that responsibility since April. And there's hundreds of thousands of tests that are conducted in the community-based testing sphere through a variety of public and private partners. And we lead that effort on behalf of the county. We also staff the county's quarantine and isolation beds, and we're in the process of opening up additional 3 sites over the next week to be able to have additional places for persons experiencing homelessness and for individuals who are leaving hospitals but don't have a safe place to go. And then we manage testing in the correctional environments in the jail and juvenile court halls and camps. You know, I know we don't intend to probably focus on the jails, but that's another place where I do anticipate increases in cases, just as a factor of, you know, where once testing volume and once positivity goes up, it's impossible to keep it out of the jails. And so we've done, I think the county's done an outstanding job to this point of trying to reduce and keep at a minimum the level of infections in the jail. But we are starting to see everything go up across the board: homeless shelters, jails, everything. So, you know, I think we have a scary month ahead. I think that it's been wonderful to see all of the partners come together. We've had a lot of wonderful participation with community-based organizations and a lot of external entities that have wanted to be a part of the solution. We've had wonderful partnerships on the community-based testing front. We just announced last week or 2 weeks ago awards to 51 community-based organizations who are taking the lead on outreach and engagement activities among persons of color and in areas that are hardest hit by COVID. And we're very thankful for that ongoing work. And we had been successful up until December of closing the gaps in the disparate positivity rates among persons experiencing homelessness and among area poverty indices. But the latest data is, I would say, not as promising. And once we start to have the positivity rate go so far, you start to see those curves split apart again. So where we need to get is to the place closer to where we were in the fall, and that's going to take everyone staying home, wearing their masks, doing all of the basics. It's really those basic public health measures that are the most important at this point. I know there's a lot of other people to speak, so I will stop, but I'm more than happy to take any questions that people have. So thanks again for letting me be part of this.
Great. Thank you so much, Dr. Galley. And for folks, if you have questions for Dr. Galley, please go ahead and put them in the Q&A box, and we'll keep an eye on those and go through as many as possible in just a moment. Next, I'd like to transition to Chris Haney from the California Budget and Policy Center, who is closely tracking the pandemic's impact at a state level. Chris, what's top of mind for you when you think about 2021?
Great, thanks, Katie, and thanks to Dr. Galley for the optimism that you shared about the vaccine's arrival and the reality about what we face for the next month, and the messages to all of us. Very much appreciated. So first and foremost, what's top of mind for me, even though we're a budget policy organization, is the intense, stark exacerbation of inequality that is emerging during the pandemic and the recession that it's fueling. Both in terms of the disparate effects in terms of public health and the economic effects in terms of the harm that's being done to communities, particularly Black, Latinx, and Native American communities, low-income communities, particularly women and women with children, and essential workers, and small businesses that are really bricks and mortar reliant. Those are the sort of parts of the economy that are disproportionately seeing the most harmful economic effects of the pandemic. And that means that we have to achieve major budget capacity in order to make the investments needed to both respond to the urgency of the crisis and to position ourselves to recover and restructure for growth that is more equitable as we hopefully come out of this sometime soon. And that kind of budget capacity means a lot more revenue. It means a lot more money somehow has to come into the system. At the state level, the challenge that we're facing there is that there's a disconnect, I think, between the reality of what the pandemic is presenting in terms of the needs and the overall fiscal picture and management of that fiscal picture at the state level. Let me say a little bit more about the details there. On the needs side, we know the needs are huge. Just the public health effects that Dr. Galley has talked about there, and the idea that we're going to need significant new and additional revenue to just do something like distribute a vaccine at scale in some sort of way in the weeks and months ahead. That's going to take significant new investment. The kinds of cash assistance that's necessary to replace people's wages when they've lost income or work. Unemployment insurance benefits and other forms of cash assistance that are needed to help keep them going economically, so they don't fall further behind and end up in a situation of homelessness or other sorts of situations that become more dire. Housing stability, where folks may be having struggles meeting rent or paying mortgages, and where there again is some cash assistance needed. One of the less told, although we're starting to hear a lot more about it, crises is the childcare crisis, the loss of providers, the loss of facilities. This is a system that was already underinvested in and way smaller than it needed to be beforehand, particularly in more vulnerable communities. And now it's seeing an erosion of its own infrastructure that needs to be both propped up in the short term and then rebuilt to be larger and more equitable in the longer term. And the issue of closure of schools. We're not going to get the economy back on track until kids can be back in schools, parents can go back to work. All that, of course, is contingent upon us being able to manage and control the public health side of this first. But that's going to take if you imagine what it takes to reopen schools as you're coming out of a pandemic, there are facilities needs, equipment needs, technology needs, people needs. That's all going to take significant investment, and we haven't even started to see the scale of what that might look like in order to bring schools back online in person in a way that would work. And so we know the needs are really significant and are going to take significant new revenues. The challenge is that I don't think state leaders right now are positioning the state for the kinds of investment that are needed. They don't seem to be in stimulus mode, and I think they need to think of themselves as providing economic stimulus in a major and significant way. They tend to be right now more in an austerity mode, and that's largely because what happens to state and local governments during economic downturns is their own revenues decline, they don't increase. And so they're trying to fill gaps, not think about investments. But there are two complicating factors in this in California. One is that, as a number of you have probably seen, the state's revenue collections are actually outperforming what was projected when state leaders enacted a budget back in June. So they enacted a budget that said that they were expecting a pretty significant shortfall and then did some things to fill that shortfall. And since that time, the revenue collections have been coming in higher than expected because of things like the stock market continuing to do surprisingly well. And our tax structure produces a lot of revenue off of the top end of the income spectrum, which tends to be people with a lot of stocks and dividend growth. So the state's revenues are doing better than expected. State's Legislative Analyst Office projects that we're going to take in $26 billion more than expected for the year. That's on a general fund that's $134 billion this year. So that's a significantly higher number. But as I was saying, it's due to stock market gains, and that actually should be convincing state leaders that they have more space to reinvest in combating the inequality that they're seeing because of the pandemic. It's not clear yet that that's exactly how the money might be invested. The second major factor here is that there's just a lot of waiting at the state level to see what the federal government might do. And there's a lot of uncertainty at the federal level. There's a package being debated right now in Congress that would do things like extend unemployment insurance benefits, provide some of the housing stability and childcare support that I was talking about earlier. But one of the major items of contention as to whether that package goes forward is a proposed $160 billion in federal funding for state and local governments. California, if form were to hold, would get a little under 10% of that $160 billion. It would be split up between state and local governments. And while that sounds fairly significant, that money would help, but it would also not completely fill the gaps. And so I say all of that because those factors, the fact that there are these big needs, and the fact that the federal government is not going to produce the level of aid that's going to be needed to help address those needs, means state leaders are going to have to think about how they fill those gaps. For philanthropy, I think that means playing a role in documenting the harm and the needs so that policymakers see that they need to do more than they're doing now. I also want to talk a little bit about the local level, because I think unlike at the state where revenues have been coming in higher than expected, there's a lot more pain that's being felt at the local level. Sales taxes from local business transactions, the closure of businesses, tourism taxes, all of those things are going to be down, and I think you're going to see a lot more deficit behavior at the local level, which is going to mean budget cuts, layoffs, furloughs, reductions in services. And I think that's a place where philanthropy, not on a permanent basis, because it can't do it at the same scale, but if there are ways that philanthropy can help fill urgent gaps, it helps us get through this period that's coming ahead, that could also be helpful. And lastly, I just want to say that if we do this well, we could come out of this sooner and with less longer term effects. So if we actually made the investments in the near term urgent crises, we could shorten the painful part of this curve and get back to a period of growth more quickly. If we don't do it well, we will basically make matters worse in terms of longer term effects for low income communities, for communities of color, and the pain from an economic perspective will last far longer than the pandemic itself in terms of the actual spike in cases might last. And so that makes the case for investments. I think if we do the work to help those who've been disproportionately harmed, then we'll recover faster overall. That'll be good for the state, it'll be good for its finances, it'll be good for locals, it'll be good for their finances, but it'll be good mostly for those people who have been most harmed. And if we use it, we can also use it as an opportunity in trying to address some of those disproportionate effects to fix some of the inequitable policies that have always been in the way of serving those communities. And that's an opportunity for us in this pandemic as well. So I'll stop there and turn it back over to you, Katie, for time for our other speakers.
Thank you, Chris. I really appreciate you highlighting that message, which I've heard quite a bit, is thinking about how we build back different and don't just repeat inequities that existed pre-pandemic, but use this as an opportunity to build something different. So lots to unpack, and folks are welcome to put their questions in the Q&A, and we'll get to those in just a moment. But last and certainly not least, I want to introduce Deepa Iyer, joining us from the Building Movement Project, which released a report in October titled "On the Front Lines: Nonprofits Led by People of Color Confront COVID-19 and Structural Racism." I'll put a link to that in the chat in just a moment for folks who might not have seen it. But I'm hoping, Deepa, you can share with us some of your findings and thoughts about how to support these nonprofits in the new year.
Yes, definitely. Thank you so much, Katie, and thank you, Dr. Gailey and Chris, and to all those who are representing philanthropy on this webinar. Really appreciate the support that you've been giving nonprofits who are on the front lines. I am going to be sharing a slide deck because I have some data points that I wanted to show you. So give me a second to do that. So as Katie mentioned, I am from the Building Movement Project, and we released a report just in October. And what we actually were hoping, and Katie, does this work? Can you give me a thumbs up if you can see it? Okay. So what we wanted to look at is specifically nonprofit leaders of color and how they were navigating the pandemic as well as the uprisings of 2020, these generational moments that we had this year. And the report compiles information from a survey that we conducted that was taken by 400 plus nonprofit leaders of color from around the country, as well as individual interviews we did. And it includes recommendations for the nonprofit sector, government, as well as philanthropy. And I believe that Katie has shared the bit.ly link so you can take a look at the full report if you're interested. So just very quickly, demographically, the survey respondents that we talked to were all people of color who lead nonprofits in the United States. They primarily identified as Black, Latinx, and Asian, and they headed organizations that are much smaller. So organizations that have less than 10 staff, as you can see from this slide, about 53% were leading organizations that had less than $1 million budget. So small, under-resourced organizations. Most groups identified themselves as being service providers, followed by groups that did advocacy or grassroots organizing. The findings that we had were sobering, and I don't think you'll be too surprised in terms of what we found. I see them as both related to external needs as well as internal organizational needs. But what we found was that the crisis is just getting worse for people of color, and the inequities that Chris mentioned are really manifesting themselves in immigrant communities, Black, Indigenous, people of color communities all around the United States. Again, revealing something that many of us already knew in terms of the inequities facing BIPOC communities that got worse and magnified because of this pandemic. We also learned that POC-led nonprofits are really pivoting to respond to these needs in various ways. We have some findings around their short-term versus their long-term financial stability. We also found that POC leaders, particularly women of color, are facing a leadership crisis. And then finally, as has been said already, that there is no returning to normal. So I'll go through some of these and hopefully can share more during the conversation. So it's not going to come as a surprise to any of you that most of our survey respondents mentioned how their people of color constituents and clients are dealing with the worst of this pandemic. Disproportionate rates of illness and death, lack of access to healthcare, unemployment, housing and food security. And they also mentioned an increase in COVID-related xenophobia and bigotry, that this was something that was coming up time and again, particularly among Asian American communities, which I know are a large segment in California, and the mental health effects of COVID-19. You can see from this particular slide that about 75% of our respondents are concerned that after people have a roof on their heads and enough food to eat, the next emergency is actually mental health and how communities of color are dealing with the effects of this pandemic for the long run. The people of color leaders that we spoke with predicted that these needs would just get worse. And they were talking about the next 3 to 6 months as being the end of this year. And just as Dr. Gailey and Chris have talked about, these needs are indeed getting worse. What the nonprofit leaders we spoke to talked about were ranged from food scarcity to resurgent outbreaks of COVID-19, a wave of domestic violence while sheltering in place, surveillance, criminalization of communities of color, to education losses, childcare losses, and the like. And so this is what people of color are dealing with, and disproportionately so. And as such, nonprofits that work with them are having to address these needs. So how are they doing that? Well, for most nonprofits that are led by people of color, they've had to pivot. And what we learned was that more organizations are engaging in direct services that they never did before. So we talked to, for example, domestic violence organizations who say that in addition to calls about domestic violence coming in over their hotline, they're also dealing with clients who have no access to food and who are facing evictions and who don't know how to apply for unemployment insurance. We also learned that more organizations are putting together cash assistance, as Chris mentioned, as well as even food banks for their local immigrant neighborhoods. They're also engaging in increased advocacy, 48% increase we saw among the groups that we talked to. And this is because these POC-led nonprofit leaders wanted to make sure that their communities' perspectives were at the table when it comes to government changes. So many of them talked about how they have been asking government agencies to make sure that information is provided in language, right? That there are multilingual referral and information materials and hubs that are available to people. That there's the ability for broadband access. We talked to many Native leaders who talked about the importance of making sure that Native communities, Indigenous communities on reservations in particular, are able to access what they need to, including children who are having to stay home from school. And then finally, organizing also on the increase. Even though it was very much election related, and you can't really organize, right, in the same way when you're social distancing, folks are finding different innovative ways in order to reach their communities. So they're pivoting to these different needs that they see in their communities. And one trend that we've seen, and Chris, you mentioned that maybe it's not as relevant in California right now, is that as government agencies are dealing with budget shortfalls in many of the states around this country, they're actually pulling back on their contracts to service providers. And so as a result of that, nonprofit service providers are having to deal with less funding for their personnel and their frontline workers while these needs are on the increase. Also wanted to mention 2 internal findings within organizations before I talk about some recommendations. We found that in the short term, many POC-led nonprofits were all right when it comes to short-term financial stability. But when we look at 2022 or even the end of 2021, that's not the case. So in the immediate aftermath of the pandemic, when we talked to nonprofit leaders, they said that earned income and individual donations were decreasing, not surprising, right? Because they weren't able to do in-person events and the like. There was not much change at the time, and this was over the summer of last year with government funding, although as I mentioned, that has shifted. And they were getting responses from their funders when it came to rapid response and emergency funds. But many nonprofit leaders said that they are concerned about the long run, that they find that they're still having to deal with philanthropic inequality when it comes to receiving funding. So that means smaller groups not receiving funding, that it's traditionally white-led organizations that are still receiving the bulk of the funding in their communities to reach communities of color that they actually don't have a lot of direct contact with, and that they're very worried that this rapid response funding is going to run out. And then the final internal finding that we found was that this entire climate is taking an immense toll on leaders of color generally, but particularly on women. And we found in some of our interviews, and I've got some quotes here, that, folks talked about how there is this extra expectation to show up in times of crisis, to be the therapist, right, for staff, to have to manage what is coming up from the community, to have to be an anchor for the community, and then also to deal with their individual concerns as well, and that it is very difficult to sustain their leadership. One leader told us that after this crisis is over, it wouldn't be surprising if many nonprofit leaders of color actually did not return to their jobs. So as I transition to the recommendations, really just wanted to highlight that, there was this big theme that we found, that there's no returning to normal, right? That we cannot return to normal, and that we need to see this generational moment and this crisis as an opportunity to rebuild and to reimagine, and not return to the same old cycles that often happen when nonprofits led by people of color are dealing with situations like the pandemic and other crises. So some recommendations for philanthropy that came up that I want to uplift. The soundbite to this is do what you're doing and do more, right? So making the changes that have already been made in 2020 permanent. So this includes unrestricted grants, easier application and reporting requirements, multi-year grants, all of those changes that many nonprofits have been making to make those permanent, to give above the usual payout requirement because it is a crisis moment. And then to really commit to Black-led and POC-led groups. And I think we'll talk about this a little bit later more, but given what we saw, especially with the uprisings, the importance to actually align internal commitments to racial equity with external grant making. And this also includes listening to the demands of Black-led and POC-led groups and supporting organizing systemic change and multiracial movement building efforts. Also addressing barriers to funding POC-led nonprofits who are usually seen as risky investments. So removing that barrier altogether, removing the barriers of nonprofits having to find funders and instead funders actually finding nonprofits. Supporting future scenario planning, balancing these rapid response emergency grants with a decades-long approach, and then finally integrating sustainability in all of the grants that are going out to support leaders of color. And lastly, some systemic and policy changes, again, with this idea of not returning to normal and not thinking that these are visions that aren't realistic or that cannot come to fruition, really supporting equitable, people-centered systemic changes that ensure that communities of color are going to thrive, not just survive, and that the organizations that are on the front lines that lead them and support them are also going to be able to make it in the long run. So I will pause there, but look forward to having a deeper conversation.
Thank you so much, Deepa. I really appreciate the recommendations. And again, for those who haven't checked out the report already, the link is in the chat. And I just really appreciate the opportunity to build on the momentum of this year. All of the incredible changes that we've seen philanthropy make in response to the pandemic are really a springboard. So that's exciting and an opportunity and a moment to seize for sure. So I've got a few questions for you all, but I want to make sure we get through our attendee questions. So I'm going to start with those. We'll remind folks that you can put your questions in the Q&A. The first question is for Dr. Galley. It's about federal coordination and support for vaccine distribution. The question says, I've read that there's not been much federal coordination and support. In light of those challenges, how is the state responding to ensure vaccines are securely distributed to where they need to go? And I wonder if you could just talk about any reflections you might have on how the new incoming administration, how the state and local government will be working with the new incoming administration and what you anticipate in the year ahead in that front.
Yeah, thanks for that. I can't speak on behalf of the state, but I can speak, here locally, that we haven't, from our vantage point, experienced any poor coordination or lack of support. It's been, I think, the hardest part about the process, and I don't know that this is anyone's fault, but there's still not a lot of information that's available about how many doses of vaccines will be distributed by geographic area or by hospital. So, for example, when we're trying to set up vaccine clinics for next week, we don't know how many doses still of a vaccine we'll have next week. Obviously makes it very hard to staff a vaccine clinic if you don't know how many doses you need to be staffing for. And I think that's the consequence of just things moving very quickly, that you don't always have all the information that you would want as far enough ahead as under ideal circumstances you would have it. The trade-off is that you could have that information far ahead, but then there would be natural lag points, which would be wasted time while you're sitting there knowing, but you can't do anything with it. So I can't complain. I just I hope that at the near future we'll start to get some more clarity and be able to project out a little bit more what those numbers will be for the foreseeable future. I do think that there's a lot of messaging that's needed with the broader public. So the Department of Public Health, our sister department, is the lead for vaccine distribution within the county. And I know I speak for them also in just knowing the massive amounts of interest naturally there is on this, and how much messaging there needs to be among the broader public to be able to both inform people what's happening, who's in the first priority tier, who's in that tier 1B. This is all still being actively developed. So I know people want to think far out in terms of, prioritization among the general population. But again, because of how rapidly this is moving and how we don't necessarily have clarity about how many doses will be available at this particular point in time, a lot of the focus is on the near term and in those initial priority populations, the 1A healthcare workers, and then the 1B, other other essential workers, and trying to think through how to operationalize that aspect of things. There will still need to be a lot of planning that takes place then in the next month or two about how do you then extrapolate that against a much larger general population and what's the right strategy to approach it there.
And that is a perfect segue actually to our next question. I'm going to combine that and the second half of the first one. I didn't forget it. So someone had asked, Emily asked, there's early polling work that showcases some distrust in the vaccine. So I want to get to specifically how philanthropy can be a partner, not just in amplifying public health messaging, but also supporting other types and channels of communication that support specifically communities of color. So folks are also asking in the Q&A about how we support Black, Indigenous, and people of color communities that are hardest hit, and make sure that they have priority access to the vaccine and just like messaging in general. So reflections on that.
Yeah, this is so important. And we've all seen the data about how there's distrust. We know that uptake of influenza vaccines and other vaccines is lower among communities of color. We know that there's lots of reasons for that: generational long mistrust of the healthcare system, of the government, lots of access to healthcare, coverage issues, lots of reasons that are going into that. And this is something that is going to have to be addressed in a multifaceted approach. There's already a lot of work, but that work needs to continue to ramp up to get the hyper-ethnic media campaign messages out to specific populations in multiple languages, in ways in which communities can understand, and messages that we know resonate within those communities. Having role models be out there, people from the community, in the community, role modeling getting the vaccine, having that be very visible as far as people who are known and trusted community resources, whether it's healthcare providers or a clinic or someone from a trusted nonprofit or community health workers, whoever it might be, having people out there that are known and trusted within the community be seen receiving the vaccine, be seen being part of the process and getting people to have access to the vaccine. The issue really isn't one in this setting of payment. We know that the vaccine will be free regardless of insurance coverage. We know that there will be mechanisms to cover that, but it really is getting the logistics of that access to be easy, and getting the trust so that people know that the vaccine is safe and that they are willing to receive it. And I think that the messaging has already started, but that just needs to massively ramp up. I do think it was encouraging that a lot of the images yesterday in the media, this was true in the New York images and the LA images, ones from other parts of the United States as well, that the people that were seen getting the vaccine first were often people of color, were often, nurses working on the front line, environmental service workers working on the front line, people that I think that there can be relation with and start to build explicitly or implicitly some of that trust in the process. But it's going to be months and months of work in that regard.
I just wanted to add on to that. I think Dr. Gailey touched upon so much already in her response, and appreciate that. I would say for philanthropy, one of the key things is to really ask BIPOC leaders how they can reach their communities and not use sort of a one-size-fits-all approach, because our communities are very different in terms of how we respond and what it is that we respond to. I think that it is very important to think about LEP, limited English proficient communities, thinking about communities that are undocumented, that are already left out of so much of the pandemic relief packages anyway, and how to reach those harder to reach communities. And then, really thinking about how to reach communities where they're at. So places of worship, community clinics, going to the community is so important, and having, as Dr. Gailey mentioned, health workers that represent the community, that can actually be the gatekeepers to these communities, is very important. And then lastly, using community media. How can ethnic media be utilized in a way to send these messages out? I think we have like models. We can look at census, for example, Census 2020 as a model for how we can actually reach harder to reach communities. And a lot of that was these partnerships with community-based organizations, hiring people who look for and sound like they're from the communities that are hardest to reach, and then not using this one-size-fits-all approach, but having different outreach mechanisms in place for communities. And the way to start all of that really is to reach out to your ongoing grantees and to ask, what kind of plan is best for your community and how can we support that?
Great, thank you both. I want to transition now to revisit some of what you were sharing, Chris, about local government. I know that we here at SCG have over the years shepherded and supported a lot of public-private partnerships and really see government as the opportunity to scale innovative solutions that philanthropy might pilot. And just hearing the concern around local government budgets, I'm wondering what reflections you might have on how we might need to think about public-private partnerships different, at least in the coming year or like 1 to 5 years, like how they might change from what we are used to seeing them as.
Well, I think that's a good follow-up to Dr. Gailey's comments, because I think what's ultimately going to be needed is a lot more formal coordination between the public sector and the philanthropic sector, between all sectors for that matter. Like we are not going to deliver a vaccine, do the level of contact tracing that's needed, provide economic assistance to the communities that are being most harmed without the public sector and philanthropy coordinating on how that happens. And one way to think about that is the public sector is in large part designing and building at the same time here as they go. And so a lot of those of you in philanthropy have been working directly in local communities for a long time, and you can inform that design build process as to help it, to help ensure that it's reaching the communities you're serving. And then you can help with the delivery of what needs to happen. So, you can be both on the upstream and the downstream side of this, but it's going to mean probably much more formal partnership with the public sector than has typically been the case. And so I think, we have this unique situation where we need the different sectors to not do their own thing. The public sector needs to realize philanthropy has a lot to offer here in terms of expertise, and philanthropy needs to realize that in order for this to be at scale, to really coordinate directly with what it's doing with the public sector where possible. I think out of that, we could emerge with some really effective models that we can sustain coming out of this. I think we're already starting to see some of that happening in the housing arena, where the federal assistance that's come down, there's been a lot more of that that's actually working both with counties and with local nonprofits. And housing's difficult, so I know those of you who do work in that are probably feeling like it feels chaotic and not very well coordinated, but there's certainly been more of that than I think there has been in the past. So we have an opportunity to see if we can learn from this. I mean, there's the urgency of having to do it, but then there's also the possibility that could lead to some more permanent infrastructure coming out of the system. I think the Newsom administration seems very inclined to these kinds of relationships. They have an Office of Social Innovation, or I can't remember exactly what it's called, but it's supposed to be trying to help facilitate this happening. I suspect that's been harder to do with the crisis at the level that it's at. But I think there's an inclination there to try to see how to help with the coordination.
Yeah, and the Office of Social Innovation just put out their first ever report on public-private partnerships recently, so we can include that in the follow-up resource email for anyone who didn't see that. Thank you so much. Kind of piggybacking on that question, I think we have a question about how current budgetary shortfalls might impact longer-term budgets in 2022 and beyond, and what does that entail for philanthropy? And you mentioned the talk about, especially at the state level, kind of wait and seeing around the federal stimulus. What should philanthropy be advocating for in stimulus packages? Any reflections on that, Chris, or anyone else?
Well, I would start by saying by advocating that there be stimulus packages. I mean, we are in this kind of absurd situation where For the first time, at least in my lifetime, where there seems to be a debate about whether a stimulus package is needed in the middle of a downturn and whether that stimulus package needs to include aid for state and local governments. That's the first step. The question about what the structure of that aid looks like is actually more known. We know we need unemployment insurance benefits urgently. We know we need housing stability and cash assistance. We know there are significant investment needs in the public health arena. So it's not a question like the structure of it. If we can just kind of get over the hump of we need a package is the first step. I think the other piece is it's harder to do this at the federal level when you're operating in California, obviously, but the state understanding that it can play a stimulative role and that its sole job is not just to enact a budget that's balanced. It may need to break some of its own rules in order to do some real good here. And in terms of the longer term effects, the real benefit here would be that we have a shot, right? If later in this year, the vaccine's been rolling out, optimism's higher, the spike in the curves the curves are headed in the right direction. The economy is pretty poised to come back quickly. It's actually already doing far better than we expected it would be doing at this juncture. So if we can get the public health side of it in a better place, we have a shot to come back quickly, which means the long-term fiscal effects may not be significant, but they will be harmful for the disproportionately harmed populations, which means we have to invest in them to make sure they're ready to come back as well. Like we know folks with stocks are going to do well, and they're probably going to hold up pretty well. We need to make sure that folks in communities of color, women, low-income communities, essential workers are in a position where they're not facing choices about going to work, losing their home, not having childcare, all of the things they're facing right now.
Can I add just one thing onto that? And certainly I agree with all the comments made, and there's so many entities and groups that need funding in the midst of this. It is somewhat amazing to me that there is debate about whether or not a stimulus package is even needed. I find that entertaining in a sad way. But a lot of what's really needed, at least for the local governments in the stimulus package, is much more flexibility with respect to how those funds can be spent. And that's specifically regarding funding for lost revenue, that the current stimulus packages generally don't allow cover for lost revenue. They allow for expenditure on new costs. But obviously both are hitting the counties and the state. They're losing revenue in terms of sales tax. Some of the property tax revenue is down, other revenue streams are down. And so they're looking at more expenditures that are needed to support all of these very valid needs out there in the community, but less money, ironically, to do it with. And so both is needed, positive money on the expenditure side and then cover for lost revenue.
Thank you. I have one more question for Deepa. You touched on this, so I want to go a little deeper. We have just a few minutes left, but as you mentioned, when the pandemic began and all through this year, we've seen funders make really supportive changes, converting restricted grants to unrestricted. And then kind of on top of that, this summer, we saw really overwhelming expressions of support for Black Lives Matter. And your research highlights really how we can continue to be supportive at that intersection. So I'm wondering if you have further reflections on what we need to do to be intentional in order to continue the momentum and not have this just be a moment.
Yeah, thank you so much. Well, I think, it's important to recognize that as nonprofits led by people of color were adapting to the pandemic and responding to the tremendous community needs, they were also dealing with the ongoing deaths and murders of Black people at the hands of vigilantes and police and law enforcement. So in the wake of the murder of George Floyd, which happened, as you know, this summer, and the uprisings all around the United States, we heard from many Black leaders in particular talking about the importance of having the support that they need to do both, right? To deal with the pandemic, which again, as we know, is disproportionately affecting Black people, as well as deal with the systemic changes that they want to put in place when it comes to safety and community policing in their community. So how do they do both? We also heard from non-Black communities, including Asian and Latinx and Native communities, about how they want to actually do more around multiracial coalition building and building alliances. So how can they be supported to do that? So I think just wanting to highlight again that these nonprofits are not just doing one thing. They're not just focused on the pandemic, right? They are focused on a range of issues that all require our attention, that all require systemic policy change. And so it's important for anyone who's supporting these organizations to understand the pressure that they're under and to, again, provide that long-term infrastructure support so that they can do the work that they're doing, both in terms of moments of crisis, but also in building for the long run.
Thank you so much. We have 5 minutes left, so I want to transition us to closing remarks. And I especially want to ask that if you haven't already, you share with us your thoughts on philanthropy's role and the greatest opportunities you see for philanthropy in the coming year to be supportive partners in pandemic response and recovery. So Dr. Galley, I'd love to start with you.
Thanks. I think what Deepa laid out there in her slide about how philanthropy can weigh in is so important, and it was nice to see that captured in such a crisp way. So thank you for doing that. I think so much of it is really around trying to support the messaging campaign outward, trying to support the community-based organizations, the ethnic media campaigns, the organizations that are having trouble either making payroll or trying to expand. We know that they can do the work, and government so often needs to work through these community organizations to be able to be the hands and the feet on the ground, doing a lot of the work that ultimately government may be funding or maybe coordinating, but the work itself is done on the ground by a lot of these critical community entities. But they often need supplemental resources. They need sometimes, data support. They need certainly opportunities for having just, expert media consultants come in, or different people who can come in and help refine a message and then help put it out broadly to the then community health workers who can be those hands and feet on the ground of trying to get it out to the individuals. So I think that philanthropy can do a lot to be a bridge between what government has planned and then what the CBOs, and whether it's the CHWs or other entities, are actually going to implement. And it would be nice for all of us to really learn over time. I think there's been some good learnings from COVID, but there could be even more. I do believe that generally government and philanthropy, in my experience, don't know how to work well together. And there's lots of opportunity for growth and improvement, but they just come from such different worlds. And it's nice to think about how we might try to continue to bridge those worlds, because I think there's a lot of positive things that could come from that, but it's a nut that really is just hard to crack because of how different those worlds are. But I think that even ourselves within DHS, some of the models that we've seen in trying to promote outreach and engagement among persons of color, and how we've been able to work with some different types of organizations, philanthropy has been helpful in that regard, and I'd love to see that pattern continue.
Thank you. Chris?
Yeah, I think either I've said it or others have said it here already in terms of what I would share, but it's, it's more coordination. It's, trying to help fill some short-term gaps that'll help us get through this to hopefully a point where we will grow back and grow out of this better. And I think the last thing I would say is don't be shy. You have to, in fact, be less shy about public policy advocacy in whatever way you can support that, because the scale is still going to be at the public sector. And unless the policy changes happen that make sure that scale is invested at the level needed and where needed, we won't be able to do as well as we respond and come out of this. So, it's an uncomfortable place a lot of the time for folks in philanthropy, but the policy advocacy space needs some attention as well.
Thank you. Go ahead, Deepa.
Yeah, I would just say, I think so much has been said. I would say, let your grantees be the visionaries and experimenters that they are. So when grantees say they have a vision for systemic change, follow them, don't question it, let them lead. Here's a link, I thought, to a really great statement by BIPOC executive directors in Washington State. It was a call to philanthropy. And then secondly, let grantees experiment with what they need to do in order to reach their communities and to ensure that their communities are surviving and thriving. So follow their lead is really, I think, what I would say at the end.
Great. Thank you all so much. I want to thank you all for your time and your work, and let attendees know that we'll have a recording of this webinar and all the resources that were shared in the chat sent out via email in the next couple days. So as we close out here, please take a moment. There's going to be a really quick survey that pops up on your screen, and that's been so helpful all year long to help us keep a pulse on member needs and response efforts. So please take that survey one more time this year. And in close, I want to thank all of the members of Philanthropy California organizations for your tireless work. I hope the holiday season brings you some opportunity for rest, and I wish you and your loved ones good health. So take care, and thank you so much, everyone.
Thank you.
Bye-bye.